Good evening. I'm sorry I can't be with you tonight, but nonetheless, in my new role as the Chair of Vision 2020, I've seen already some fabulous things. We're doing this piece of filming in Phnom Penh, and on my visit here, I've been out to provinces outside Phnom Penh, seen a woman who in her early 20s ended up blind. There's nothing that can be done about that, but CBM are helping her. She's now got a small shop, and she can make an income from that, has earned respect in her community, and has a much better life than she otherwise would have. On the other hand, this morning I've been to another province on the outskirts of Phnom Penh, come across a woman with whom I would not argue, and she's got the Brian Holden Vision Institute to do an outreach program to this district on the outskirts of Phnom Penh, where they do eye testing, check what glasses you need, and come back in a week with the glasses. And just from the program they're doing there today, there'll be about 100 people who'll have glasses who wouldn't otherwise have had them. In other words, who'll be able to see. And those of you who wear glasses understand what I mean. And then, of course, I've seen cataract surgery today on women, especially who otherwise just wouldn't be able to see more than maybe a metre in front of them. And that's with the work of Fred Holland, association with Ransco, doing a tremendous job. This is really impressive work that's being done by the Vision 2020 Global Consortium. Really impressive work. As a part of this trip, I've met the very impressive Dr Phuc, who's the Associate Director of the East Asia region for Fred Hollows, and we're going to talk to him now. Dr Phuc, you're based in Vietnam, but you work in a broader region. What are the changes that you've seen in eye health in Vietnam and Cambodia over the last decade or so?
There are a lot of change in Vietnam. We have done the eye care for 20 years. We can see at first they have only 2-3 surgeons. Now they have about 550 surgeons.
550?
Yep. And at first they had operate cataract around 1,000 case a year. Now they operate over 200,000 cases per year. So Vietnam can say no more trachoma, no more xerophthalmia, and now they just focus on cataract. They're doing well, and now they tackle the diabetic retinopathy. In Cambodia, there are also a lot of improvement. The foundation had the first ophthalmology training program, and from the 7 eye doctors in the whole Cambodia now, they have the 60 doctors. And they can bring the number of cataract surgery per year from 500 since 1998 to over 1,800 now. So I think a lot of change in the eye health.
Why are the programs run by the Global Consortium so important?
I think the Global Consortium program is important. In my opinion, it can bring the ON and RIO together, working together. And RIO can complement each other by using the strength of each and RIO. For example, Brian Holden is very good in refraction training. The foundation is really good in cataract surgery, while the CBM is very good in the disability inclusive. So they can complement each other. The second, they can share the lesson, and they can bring on the NGO growth together. The third one, they can work for a broader scope, and that's why can bring the more effective result and to give the broader impact.
Perhaps we shouldn't ask this question because it's an open-ended one. What more would you like to see done?
I see we have done a great achievement. However, still have a lot of things I want to see it happen. I want to see the local government funding increase. I want to see the local government commitment to eye health increase. And eye health will go to the top in the agenda of the public health to people. I want that every people to understand the very importance of the vision care so that they can protect their eyes. And I want that the number of the doctors and nurses an eye care service provider in the country increase and provide a high quality eye care service.
I'm sure you've had many, many memorable moments in doing this work. Seeing people who haven't been able to see it now can. It's a tremendous opportunity. But if you had to name one, what's the most memorable moment in your work?
Just thinking about one boy, 8 years old. He was the little boy in the jungle ethnic minority group in Vietnam, and he got the congenital cataract, and he was detected by our outreach team, and we brought him to the hospital to do operation. The doctor who do the operation is a female surgeon, and she can make the surgery for that boy, both eye at the same time. And on the next day, the operation is a miracle, a successful. The boy can open the eye and he can run out in the schoolyard like every normal boy, not a shy boy in the jungle of yesterday. But the most important thing, that's my memorable, is that the female doctor is the doctor we have trained for about 3 years. And that is the moment she was confident to do for the both surgery in the same time in one little boy, and her operation is successful. I think it's one of the most memorable story I will remember.
Training is very important.
Yep, the human power, the human resource, the training is very important, and the training to the female surgeon is even more important.
Thank you very much, Dr. Phuc.
Thank you, Amanda.
Well, you can see why Dr. Phuc's a hero, can't you? If you didn't have your bleary-eyed over the 8-year-old kid that could finally see, run out in the schoolyard, surely he got you with a female doctor after a few years training, confident enough in an outreach program to do double surgery on the eyes in one day, and the kid can see the next day. Believe me, Vision 2020 do a great job.